23-year-old Emma woke up this morning in her apartment. She got dressed, made coffee, scrolled through Instagram, went to work, smiled at her coworkers, came home, ordered dinner. And then, alone in her room, she broke down crying for the third time this week. She doesn't know why. She can't explain it. She just knows something is deeply wrong. Emma is not alone. Right now, across America, millions of people are living this exact same double life, functional on the outside, collapsing on the inside. A silent crisis is tearing through this nation, destroying families, relationships, workplaces, and entire communities from within. This is America's mental health emergency. And it's worse than you think. The numbers are staggering. According to recent reports from the CDC, the Surgeon General's office, Harvard, Yale, and national health organizations, mental illness has exploded into one of the biggest public health emergencies in United States history. 1 in 2 Americans will face a mental disorder at some point in their lives. Over 52 million adults are currently living with anxiety, depression, or trauma. More than 60% of them receive no treatment whatsoever. Suicide is now the second leading cause of death for people aged 10 to 34. Let that sink in. Children, teenagers, young adults, dying not from disease or accidents, but from despair. This is not just a medical issue. This is an emotional, economic, and generational catastrophe. And understanding why it's happening is the first step toward survival. Why the crisis? Loneliness epidemic. In 2024, the U.S. Surgeon General made an unprecedented declaration: loneliness is now a public health epidemic in America. Nearly 50% of American adults report feeling alone most of the time. Young adults, the most digitally connected generation in history, report the lowest levels of real social connection in over 50 years. Humans are wired for community. We evolved to live in tribes, to share meals, to know our neighbors, to feel seen and heard by others. Without that connection, the brain begins to deteriorate. Loneliness triggers the same stress response as physical pain. It weakens the immune system. It increases inflammation. It literally shortens your life. Yet America has become more isolated than ever before. Families are scattered across states. Neighborhoods are full of strangers. People work from home, order food to their door, and can go days without a single meaningful conversation. We are surrounded by people, and utterly alone. Financial stress breaking minds. A 2024 study from Harvard Kennedy School revealed that money is the #1 source of mental distress in America. 71% of Americans say financial pressure is actively harming their mental health. It's not hard to see why. Rent keeps rising. Groceries cost more every month. Medical bills pile up. Student loans never end. Gas prices fluctuate wildly. Childcare is unaffordable. Savings accounts stay empty. The average American is locked in a cycle of constant financial anxiety. And when your brain is stuck in survival mode, worrying about bills, about making rent, about what happens if the car breaks down, it cannot stay healthy. Chronic stress floods the body with cortisol, rewires neural pathways, and trains the mind to expect disaster at every turn. You cannot heal a mind that never feels safe. Digital overload destroying self-worth. According to recent research from Yale School of Medicine, heavy social media use is directly linked to increased anxiety, depression, comparison, jealousy, and loneliness. Teen depression rates have more than doubled in the past decade. Social comparison has become one of the strongest triggers of emotional collapse. Every day, millions of Americans open their phones and see curated perfection. Beautiful vacations. Perfect bodies. dream jobs, happy relationships, luxurious homes. And then they look at their own lives and feel like failures. The comparison is constant, relentless, toxic. And it's destroying self-esteem across every age group. People no longer measure their worth by their own progress, they measure it against strangers on the internet who only show their highlights. The result? A generation convinced they're not good enough, not successful enough, not happy enough. And the worst part? They blame themselves for it. The numbers that reveal a nation in suicide rates climbing. The CDC's early 2025 estimates show that suicide rates increased again in 2024. Young people are the most affected demographic. Male suicide rates are at their highest levels in decades. Every day in America, approximately 132 people die by suicide. That's one person every 11 minutes. Behind each number is a family destroyed, a community shattered, a life that felt it had no other option. Teen mental health collapse. A 2024 report from KFF found that 57% of teen girls report feeling persistently sad or hopeless. 22% have seriously considered suicide. Cyberbullying cases continue to rise every year, with social media platforms becoming battlegrounds for cruelty and humiliation. An entire generation is growing up without emotional safety. They're navigating puberty, identity formation, academic pressure, and social dynamics while being constantly monitored, judged, and compared online. Childhood used to be a protected space. Now it's a performance reviewed by thousands. The therapy shortage. The American Psychological Association reported in 2024 that 6 out of 10 therapists cannot take new patients. Wait times often stretch 3 to 6 months. Many rural areas have no full-time psychiatrists at all. Millions of Americans need help. They know they need help. They're willing to seek help. But when they finally reach out, they're told there's no room. The system is overwhelmed. The resources don't exist. So they go back to suffering in silence, convinced that even the mental health system has given up on them. Workplace burnout at crisis levels. A 2024 Gallup study revealed that the U.S. workforce is the most stressed in the entire world. Burnout has risen 24% since 2020. 43% of workers feel emotionally exhausted every single day. Work used to be one part of life. Now it consumes everything. Emails at midnight. Deadlines on weekends. Constant pressure to do more with less. No boundaries. No rest. No recovery. Stress is no longer an occasional problem, it's built into the American workweek. And bodies and minds are breaking under the weight. America's new TRUMA, the pandemic aftershock. The emotional scars of 2020 through 2023 have not healed. Anxiety levels remain far above pre-pandemic baselines. Millions experienced loss of loved ones, of jobs, of stability, of hope. That trauma didn't disappear when lockdowns ended. It burrowed deep into the national psyche. Economic insecurity as a constant threat. Unstable jobs. Unpredictable bills. Rising costs everywhere. The promise of stability that previous generations enjoyed has vanished. Americans can no longer count on steady employment, affordable housing, or economic mobility. Fear has become the default emotional state. And fear, when sustained for years, becomes something darker: hopelessness. Community breakdown. Families are more geographically scattered. Neighborhoods are filled with people who never speak. Churches, civic groups, and community organizations have lost membership. Trust between neighbors has eroded. America is losing the human connections that once protected mental health. The safety nets, both social and emotional, are disappearing. Identity crisis in the digital age. Millions of Americans feel lost. They scroll through endless feeds of influencers, celebrities, and strangers living seemingly perfect lives. They compare their worst moments to everyone else's best moments. Self-esteem has collapsed to historic lows. Purpose feels elusive. Meaning seems out of reach. And the constant noise of digital life drowns out the quiet voice inside that once knew who they were. Real stories of invisible pain. A 19-year-old woman from Ohio told researchers, "I feel like everyone around me is moving forward except me. I feel like I'm disappearing, and nobody notices." A truck driver in Texas said, "My bills are crushing me. I cry alone at night because I don't want my kids to see that their dad is breaking." A 29-year-old software engineer in California shared, "I have money. I have an apartment. I have a career. But when I wake up every morning, nothing feels meaningful. I don't know what I'm working toward anymore." These are not isolated cases. These voices represent millions of invisible struggles happening across the nation right now. People who look fine. People who seem successful. People who are quietly drowning. Part 5. The cost of ignoring this crisis. Public health experts warn that if America continues ignoring this emergency, the consequences will be catastrophic. The World Health Organization estimates that untreated mental illness could cost the U.S. economy over $1 trillion annually by 2030. Suicide rates could surpass car accidents as a leading cause of death. Schools and workplaces may face mass collapse from burnout. An entire generation could grow up emotionally damaged, unable to form healthy relationships, hold steady jobs, or raise stable families. Mental health is not a luxury. It's not optional. It's not something that only affects other people. It is the foundation of a stable, functioning society. And when that foundation cracks, everything built on top of it begins to crumble. What America needs to do. Experts from Harvard, MIT, the American Psychological Association, and the Surgeon General's office have outlined clear action steps. Build community programs and safe social spaces where people can connect face-to-face. Improve mental health access in schools with counselors, support groups, and early intervention programs. Launch national loneliness prevention strategies that bring neighborhoods back together. Provide more funding and support for youth mental health services. Create healthier digital environments for teens with stronger protections against cyberbullying and social media harm. Mandate mental health support and burnout prevention in workplaces. These changes take time, resources, and political will. But millions of Americans need help right now. Today. This moment. And they cannot wait for systems to catch up. Closing. America is full of people who smile in public and break down in private. People who pretend to be strong because they don't want to burden anyone else. People who feel utterly lost even when surrounded by others. Emma, the woman from the beginning of this video, is still trying to figure out why she feels this way. She still doesn't have an answer. But what she does have, what millions of Americans desperately need, is permission to stop pretending. It's time to say it clearly and without shame, it's okay to not be okay. Healing begins when we stop hiding the pain and start understanding it. When we stop treating mental health as a personal failure and start recognizing it as a public crisis. When we stop telling people to just push through and start building the systems, communities, and support networks they actually need. This is the reality behind America's mental health emergency. And acknowledging it is the first step toward surviving it.